What's up, guys? I just finished speaking with a patient now, and he said, in fact, it was his son, because his son is the one that is paying. His son said he's so surprised the way I was so professional with the patient. I was monitoring the SpO2, oxygen saturation, the pulse rate, every activity I did, because the patient is frail. Every activity I did, I wanted to make sure the vitals were good. You know, he was like, Now he thought physiotherapy is all about just something you go and learn, like where you learn mechanic work, and then you start. As he said it, I laughed. You know, it was actually very funny. You know, but I got to tell him, say, physiotherapy now. I went to school and I got my degree in physiotherapy, right? You know, I went to classes with your medical doctors. I went to classes with them. I went to anatomy. In fact, we started off year 1, we did the same courses. Year 2, we did the same courses. Year 3, we did the same courses. It was from year 3 that we now started offering departmental courses as well. Right? So all their anatomies, all their physiologies, all their biochemistry, medical biochemistry, all their pathology. We also did pharmacology and then all whatnot. And we all went to clinical postings together. Right? So physiotherapy, if anybody tells you he's a physiotherapist and he doesn't have a medical license to practice physiotherapy, he's a quack. You don't go and learn physiotherapy from somewhere. Do you understand? No. You go to school, just like you go to school to become a doctor. You go to school to become a physiotherapist. That's actually the funniest thing I heard today. I mean, so those that are wondering, physiotherapists, it's that profession where you treat medical physiotherapy is that profession where you restore people to form and function, right? Because people get disabilities, especially after certain medical conditions like stroke, like arthritis, like Parkinson's disease, like all manner of conditions that affect people's movement, affects people's function. That's where physiotherapy step in. As far as it has affected your functionality, your movement, your ability to walk, your ability to stand, your ability to use your hands, your ability to use your legs. In fact, if it is giving you so much pain, physiotherapy steps in. And that's our job. So the doctor would typically refer you to a physiotherapist and you will see them. However, you don't necessarily need a doctor to refer before a physiotherapist can see you. When you come to a physiotherapist, we can assess you and know if it is something we are supposed to treat you for or if we should refer you to the doctor. So that is